An important new book examines the overuse of healthcare and the implications for health policy. Author Robert M. Kaplan discusses the findings of Disease, Diagnosis, and Dollars.
Disease, Diagnosis, and Dollars is about the overuse of healthcare in the United States and the effect it has both on the economy and the health of our population. We're spending about $2 trillion on healthcare in the United States each year, and about a third of that, or $600 to $700 billion, is spent on tests and procedures that have no impact on health outcomes. And one of the problems is that providers of healthcare and providers of healthcare products have tried to expand the market for healthcare by creating new definitions of disease, making people who are really well sick. We know that a variety of suppliers of pharmaceutical products or health services have worked very hard to get new definitions of disease that include almost the entire population. And so if we provide all services for all people, we're going to be spending lots and lots of money on services that provide only minimal or no benefit for the population. As we spend more on unnecessary care, more and more employers decide that they don't want to provide health insurance because it's just become too expensive. And the ultimate result is an increase in the uninsured rate and ultimately a reduction in population health status. Part of the argument that we make in this book is, in fact, spending in healthcare isn't necessarily good in and of itself. And sometimes overexpenditure in healthcare can produce harm rather than benefit. In this book analyzes the cost effectiveness of a lot of our investments in prevention and finds them wanting. We've been hearing over the last couple of years that it's very good to get reduce the threshold for diagnosis of high cholesterol or high blood pressure or high blood glucose because we're catching disease very early. And what we've done in this book is we've gone through and systematically analyzed some of those and discovered that in fact when we lower the threshold or change the definition of what high cholesterol is or high blood pressure, we end up spending an enormous amount of money on people that are relatively well. And some people, like the American Cancer Society, might not like this message because the book attacks sacred cows like screening for breast cancer, which we know has relatively little benefit. And hopefully what I'm going to do with this book is stimulate some discussion about these issues.